Another trick I would like to mention here is to use the D-finder and a reciprocating handpiece. It's really, really, really important to know that D-finder on a reciprocating handpiece to do this watch winding motion is very helpful on bypassing our broken file case. So as I told you, Rogin files on bypassing, they are perfect. Look at this case, for example, here I have a broken file and I bypassed it. When's my protocol in bypassing? Manually first with K file number 10, 15, 20, and 25. And then after that, I use Rogin files number 2004, then number 2504, and in some cases, I go to 3004. And these Rogin rotary files were really, really great on bypassing after bypassing it manually first up to K file number 25. Now, we will move to some cases of broken file bypass. Why I choose bypass and how I did it, and if I have a certain problem or certain specific issue in these cases, I will mention. Here, in this case, the first case, I have a broken file on the mesiolingual canal of a lower first molar, and the tooth is necrotic. And as you can see from the X-ray, we have a very long, thin root canal. If I decide here to retrieve, indeed, it will be very, very catastrophic and destructive to the root canal. So I decided here to bypass. And as I say, and as I mentioned before, I start first to gain a catch with the finder, and then with K file, after doing for sure coronal flaring, and then with K file number 10, I start this watch winding motion until I bypass the file. And once I have a catch or bypass the file, I go to do X-ray to be sure that I'm in the right way on my work. Sorry. And here you can see I bypassed the broken file completely. And here is the post-operative X-ray or the obturation X-ray. Here is with the distal shaft. You can see here is the file, and here I bypass even with the Gataberka cone. And here is with the mesial shaft and some lateral canals. And even here we have a loop filled. And I hope it's a 3D obturation. I hope, touching wood. All right. So in this case, I choose bypass. Why? Because it will be more conservative. Why? Because I have a long thin root, and also I have here the two mesial canals are not connecting together. So I have to deal with this file inside the canal. I have to clean beyond the file. I have to irrigate well and shave well beyond the file, and also to obturate or have a good apical seal beyond the file. Another case with a broken file deep inside the canal in a mesiolingual root, canal of a mesial root of lower first molar. And I bypassed here, and I was lucky to bypass from the inner curve. And here, I was very lucky that the two canals, the two mesial canals are tied to and opening together. So it will be easier in bypassing and also easier in obturation. And for the idea of if you have a type 2 and they are connecting together and you just shave one canal and the other canal, you obturate to the level of the broken file, I don't like this idea. As long as you can bypass the file, so you will irrigate more inside the canal. So why not you bypass it and irrigate much more better? Anyhow, another case, here we have a nerve brooch broken inside a mesial canal of lower first molar. And here the problem was not bypassing. Bypassing in such cases will be very, very easy. The problem is not to push